Hepatitis C. Greetings from Halal Medical. Welcome back to our channel. Today we are going to talk about a topic that affects millions of people around the world, but it is a topic now filled with incredible hope. We are discussing hepatitis C. For many years, a diagnosis of hepatitis C was a source of great worry and uncertainty. The treatments were difficult and a cure was never guaranteed. Many people lived with the virus for decades, often without even knowing they had it, as it quietly caused damage to their liver over a long period of time. This silence made the virus particularly dangerous, allowing it to progress unnoticed. However, the story of hepatitis C has changed dramatically in recent years. Scientific breakthroughs have given us a new chapter, one defined by success and optimism. We now have powerful, safe, and effective tools to fight this virus, have very few side effects for most people, and can cure the vast majority of infections in just a matter of weeks. This is a monumental shift in medicine, and it is a message that everyone needs to hear. You can get well, and you can live a full, healthy life after the virus is gone. The purpose of our discussion today is to give you clear, simple information that empowers you to take control of your health. We want to remove the fear and replace it with facts. We will walk you through what hepatitis C is, how you can get it, and what signs you might look for. More importantly, we will explain the simple testing process and the straightforward path to a cure that now exists. So, hepatitis C is a challenge we can overcome. It is a beatable opponent. The information we are sharing is meant to be a guide, a source of encouragement, and a call to action for everyone. Whether you are concerned about your own health, a friend's, or a family member's, the message is the same. A cure is not just possible, it is probable. Let us explore how we can make this a reality for everyone, together, starting right now with understanding the basics. So, what exactly is hepatitis C? Let's break it down in simple terms. Hepatitis C is a virus which is a tiny germ that can get inside your body and make you sick. This particular virus has a preference for one specific organ, your liver. When the hepatitis C virus enters your bloodstream, it travels to your liver and begins to live and make copies of itself there. This process causes inflammation, which is your body's way of responding to an injury or infection. Think of it like a cut on your skin getting red and swollen. A similar process happens inside your liver, but it can continue for a very long time. When the liver is inflamed for a long time, which we call a chronic infection, it can become damaged. This damage can start as scarring, and over many years, this scarring can become severe. When the liver is heavily scarred, it cannot do its job as well, which can lead to serious health problems down the road. One of the most challenging things about hepatitis C is that it is often a silent infection. This means that many people who have the virus do not feel sick at all, sometimes for 10 years, 20 years, even 30 years. They go about their daily lives with no idea that the virus is slowly causing harm to their liver. Because there are no obvious symptoms in the early stages, a person would have no reason to see a doctor about it. This is why awareness and testing are so incredibly important. Waiting for symptoms to appear means waiting until the liver may already have significant damage. The good news is that even if the virus has been present for a long time, we can stop it in its tracks. The goal of treatment is to completely remove the virus from your body. When the virus is gone, the inflammation in the liver stops. This gives your liver a chance to heal and can prevent further damage from occurring. Understanding that hepatitis C is simply a virus that targets the liver helps demystify the condition and makes it clear that it is a medical issue that we now have a very effective solution for. It's not a personal failing, it's an infection we can cure. It is very important to understand exactly how hepatitis C spreads because there is a lot of misinformation that can cause unnecessary fear and stigma. The virus is transmitted through blood-to-blood contact. This means blood from someone with Hep C must enter another person's bloodstream. It is not spread through the air like a cold, nor through casual, everyday interactions. The primary route is direct exposure to infected blood, which happens in a few specific ways. The most common way today is sharing needles, sharing syringes, sharing other injection equipment used to prepare and inject drugs. Even microscopic blood on a needle or in a syringe can infect the next person. In the past, before 1992, people were infected via blood transfusions, organ transplants, because blood wasn't screened. Today the blood supply in places like the United States is very safe, but risk remains where screening is weaker. Other potential routes: medical care with unsterilized equipment, dental care with unsterilized equipment. This is rare in regulated settings but can occur with unlicensed providers, or in some countries, getting a tattoo, getting a body piercing at facilities that don't follow hygiene protocols can pose a risk. For example, not using new sterile needles and ink per client. Less commonly, Hep C can pass from a mother to her baby during childbirth. It can also, though rarely, be transmitted via sexual contact if blood is present. It is just as important to know how you cannot get hepatitis C. You cannot get it from hugging, kissing, shaking hands. You will not get it from sharing food, sharing drinks, or sharing eating utensils. You cannot get it from someone coughing or sneezing near you. It is not transmitted through toilet seats, swimming pools. Show a clear graphic. 2 side-by-side lists. How it spreads, and how it does not spread. Understanding these facts helps us support people with Hep C without fear. They are not a danger to friends, family, or co-workers in everyday life. The key is blood. Preventing exposure to blood is the foundation of prevention. As we mentioned, hepatitis C is often silent, but when signs and symptoms do appear, they are often vague and can be mistaken for other illnesses. When the infection is new, some people might experience a short flu-like illness. However, most people do not. For those with a long-term, chronic infection, symptoms that eventually develop relate to the liver struggling to do its job. One of the most common complaints is a deep, persistent fatigue that does not go away with rest. Loss of appetite, nausea, a general feeling of being unwell. Other signs can be more specific to liver problems, pain or discomfort in the upper right side of the abdomen. You might also see changes in urine color. It can become dark, like tea or cola. Stools might become pale or clay-colored. One well-known sign is jaundice, yellowing of the skin and the whites of the eyes. This happens when the liver cannot properly process bilirubin. Because these signs can be absent or mild, the only way to know for sure is to get tested. The testing process is simple and starts with a basic blood test. This first test looks for antibodies to the hepatitis C virus. Antibodies are proteins your immune system makes when it encounters a virus. A positive antibody test means you have been exposed to the virus at some point. It doesn't tell you if the infection is active. Some people clear the virus on their own. If the antibody test is positive, your doctor will order a second follow-up blood test. This test is called an RNA, or viral load test, and looks for the virus itself in your blood. A positive viral load confirms a current, active hepatitis C infection and eligibility for treatment. Your doctor may then recommend other tests, like an ultrasound, or a different type of blood test. The first and most critical step is asking your doctor for that initial test. If you are diagnosed with an active hepatitis C infection, please hear this clearly. The future is very bright. The treatments we have today are one of the great success stories of modern medicine. They are not like the old treatments that involved long courses of injections and had difficult side effects. The new standard of care is a class of medications called direct-acting antivirals, or DAAs. These are pills that you take by mouth, usually just once a day or twice a day. They are designed to directly attack the hepatitis C virus and stop it from making copies of itself. The treatment course is remarkably short. For most people, it lasts between 8 and 12 weeks. During this time, you simply take your pills as prescribed by your doctor. These medications are incredibly effective with cure rates of over 95%. Think about that for a moment. More than 19 out of 20 people who complete the treatment are cured of the virus. Furthermore, these DAA medications are very safe and well tolerated by most patients. The side effects are usually mild, if any are experienced at all. Some people report feeling a little tired or having a slight headache, but many feel perfectly normal throughout the entire course. The treatment steps are refreshingly simple and straightforward. The first step, after diagnosis, is to talk with a doctor who has experience treating hepatitis C. They will determine which specific DAA medication is right for you, based on the specific type of hepatitis C virus you have and the health of your liver. Step 2 is taking the medication every single day for the full course exactly as prescribed. It is very important not to miss doses. The final step comes after you have finished the treatment. About 12 weeks later, you will have a follow-up blood test to confirm the virus is gone. A cure in this context has a very specific meaning. It means that the virus is no longer detectable in your blood. When the virus is gone, the inflammation in your liver stops, which halts any further damage. This significantly lowers your risk of developing serious liver disease, liver cancer, and other complications in the future. It is a true fresh start for your liver and your overall health. The journey from diagnosis to cure is now faster, easier, and more successful than ever before. Do not let old stories about difficult treatments stop you from seeking care today. We have the tools to cure hepatitis C, but we cannot win this fight without you. Everyone has a role to play, starting with prevention. The best way to beat hepatitis C is to not get it in the first place. This means being mindful of the risks. The most important preventive step is to never share needles, syringes, or any other drug injection equipment. If you use injectable drugs, always use new sterile supplies. Many communities have syringe service programs that provide sterile equipment and can be a vital resource for staying safe. This single action can prevent countless new infections. Beyond that, always insist on safety in any situation where you might be exposed to blood. If you are getting a tattoo, a piercing, or even acupuncture, make sure the facility is licensed. When receiving medical or dental care, especially while traveling, be aware of the hygiene standards. In healthcare settings, workers should always follow universal precautions, such as wearing gloves when handling blood. These simple but critical safety measures protect you and everyone around you from hepatitis C and other bloodborne infections. For those who may be at risk, the most powerful action you can take is to get tested. Certain groups should strongly consider testing. This includes anyone born between 1945 and 1965. Also, anyone who has ever used injected drugs, even just once long ago, should be tested. If you received a blood transfusion or organ transplant before the early 1990s or have ever been on hemodialysis, testing is recommended. Finally, we can all contribute by spreading this message of hope and action. If you know someone who might be at risk, encourage them to get tested. Share what you have learned today, that the tests are simple and the cure is real. Be a source of support, not judgment. Help end the stigma by talking about hepatitis C as a treatable medical condition, which it is. Together, by raising awareness, practicing prevention, getting tested, and supporting one another, we can make a huge difference. We can save lives and work toward a future where hepatitis C is no longer a threat. Did you find his video helpful? Please hit the like button and share it with your friend to spread the word. If you haven't subscribed yet, subscribe now so you do not miss any new video.